Hello and welcome. I'm Saad Dino, pharmacist and co-owner of Acton Pharmacy, West Concord Pharmacy, and Keys Drug in Newton. I would like to welcome everyone back to our show, A Healthier You. Our goal is to discuss current health topics and to provide information that will guide you to a healthier lifestyle. Today, we will be discussing seasonal allergies with Dr. Sarah Narayan, board-certified allergist at Allergy West in Westford. Thank you, doctor, for being here today.
Thank you for having me.
I appreciate it. Thank you so much for taking the time. Can you tell us a little bit about yourself, please, and what you do, and so on and so forth?
Sure. My name is Sarah Narayan. I am from New England. I grew up in Groton, and I came back here after my training to be near my family and in the area that I love. We started Allergy West, which is a practice of Pediatrics West, 4 years ago in 2012. At first it was just myself, and we've expanded and brought on Dr. Priyal Amin about a year and a half ago, and together we're seeing both pediatric and adult patients and providing great allergy services.
Where did you get your training from, doctor, if I may ask?
Did my my medical school training at St. George's University and my allergy fellowship at SUNY Downstate in Brooklyn, New York.
Awesome, thank you. Allergies are everywhere. I mean, a lot of people suffer from allergies, and that's why we're doing the show today. As the season is approaching, I believe. What are the causes of seasonal allergies, and when do you think they start?
People suffer from seasonal allergies triggered by many different allergens in our environment, and it depends on the season. Most seasonal allergies are triggered by a variety of different pollens, tree pollens, grass pollens, in the fall, weeds and ragweed, but molds can also cause environmental allergens that can trigger or contribute to seasonal allergies as well.
Okay, so, you know, if you read a lot of data, a lot of allergy and asthma rates have climbed in recent decades.
Sure.
Can you tell us why that might be?
I think there's a variety of different reasons. I think part of it is that we're more aware of allergies. More people are getting tested, more people are being treated and taking care of their allergy and asthma symptoms. I think part of it is something called the hygiene hypothesis, which I think is partly contributing to the increase in allergies in general. And so sort of what that hypothesis is based on is that we're all too clean. We use too much hand sanitizers, we use too many antibiotics, and our body just isn't forced to mount a reaction to a lot of the infections that historically we've all been exposed to. And an IgE antibody, which is the antibody that causes allergies, is also meant to fight against parasitic infections, and when our immune system is not forced to deal with lots of infections, it can sometimes skew down the wrong pathway. So I think that probably has contributed to allergies to some degree.
Interesting. Now, specifically in this region,
Sure.
New England region,
Sure.
Is there any way to avoid pollen for those that are allergic to it? And it seems, you know, ambiguous with this golden dust appearing on cars, sidewalks, and homes. I'm not sure how we could
Sure.
avoid it. But if you could discuss that a little bit, if you don't mind.
Pretty hard to avoid. I mean, unless you want to stay inside all spring, summer, and fall long, which most people don't. It can be a beautiful season here in New England.
Sure.
Some ways to decrease exposure to the pollens that we're exposed to this time of year: keeping household windows closed.
Okay.
Making sure that we're showering every night before bed, or at least rinsing off, so that we're not bringing pollen into bed with us, so that it's not affecting us at night while we're sleeping.
I've heard that one before, okay.
Sometimes during really high pollen days, actually wearing things like sunglasses to protect the eyes so that the pollen isn't floating directly into the eyes. If you're outdoors mowing the lawn or doing some yard work like that and you know that you're really sensitive, sometimes wearing a mask can be helpful. But short of that, it's really hard to prevent exposure.
I mean, there are some days when, I mean, cars are covered.
There
absolutely covered. So does a mild or a harsh winter have any play when it comes to allergy season?
I
in your
mean,
opinion?
the earlier we start to rewarm, often the earlier the pollen is. The rainier our season is, sometimes that can play a role in there being more pollen, and also more mold spores, which contribute to a lot of people's allergies as well. So the harsher the winter, the longer the winter, sometimes things are put off, and it can kind of go both ways, because if, like last winter when it was cold and snowy for such a long time, it was late that the tree pollens were pollinating, and then we kind of had everything bloom at once, the trees and the grasses, and everyone was kind of bombarded with two triggers. So that I think that played a lot of role in why last spring was so difficult.
So just from people coming into the pharmacy and straight to your office, I may say I have allergies, but compared to what you have, which could be severe, mine is mild. Why? Why? I mean, obviously everybody is different. We understand that as a human beings, but why would your allergy symptoms be more severe than mine? Let's say.
Everyone's different.
Okay.
I mean, it can be, some of it is genetic. Sometimes if someone also has a diagnosis of asthma, allergies can contribute to that, and that can definitely make your season worse. It depends on the year, it depends on the person. It's really hard to say why one person's allergies are worse than the other. Just that some people perceive symptoms differently, and some people truly have a more heightened response to the allergens.
So, well, this is another question that I get, I'm sure you get as well. How could I distinguish between a cold and an allergy symptoms?
It's hard. A lot of those symptoms are similar.
Okay.
I think one thing that we can look at a little bit is history. So if someone every March is going to their doctor with horrible cold symptoms, we can kind of historically look back and say, well, maybe that really is allergies and not a cold. But the symptoms are similar, and I think we have to look a little bit at the time of the year. I think we have to look a little bit at what symptoms we're having. Are we having fevers associated with it? And whether or not they're responding to typical allergy therapy.
And can you describe some of those allergy therapies?
Sure.
If you don't mind, we could dig into the treatments a little bit, and then we can go back to
Sure.
a little symptoms and such. If you don't mind, go ahead.
Yeah. So
That'd be
I
awesome.
mean, when people come in and we talk about what different treatment options there are for seasonal or environmental allergies, I kind of put therapy into three different categories: environmental controls, allergy medications, and allergy shots. So in terms of environmental control, some of the things that we just talked about, keeping windows closed and such, but that's awfully hard for pollen because people don't want to stay inside all spring and summer. In terms of allergy medications, there are a variety of different allergy medications that are available to us. Some of the most common include some of the long-acting antihistamines. Loratadine, cetirizine, fexofenadine are all available over the counter, and they tend to be a lot less sedating than the shorter acting, like the diphenhydramine that sometimes people use. They tend to last not quite as long and make people very sleepy. Although some of the longer acting antihistamines can cause some sedation.
Absolutely.
So it's something that people need to think a little bit about, and everybody responds differently. So a little bit of a trial and error.
So when it comes to, typical symptoms include maybe affecting the eyes, the nose, the mouth, the lungs. What therapies do you utilize for different parts of the body? I mean,
it depends a little bit on the person. A lot of people have a variety of different symptoms, not just one symptom. I do find that the long-acting antihistamines can be helpful. One of the more effective medications, both in treating some of the nasal symptoms and the eye symptoms, I find are the nasal steroid sprays. Some of them are now available over the counter. Some of them are still by prescription only. But I have found that there are studies that have been done looking at the antihistamines and the nasal sprays and some other therapies, and the nasal steroid sprays tend to be one of the most effective allergy medications.
So the nasal sprays, are they, what are they treating in the sense? They're not treating the allergy.
They're treating inflammation.
Okay.
They're treating inflammation. They're decreasing inflammation up in the sinuses. Yeah. They can help improve drainage. They can help improve congestion. They can help with sneezing, and actually can, because they're helping with some of the inflammation, they can help with some of the eye symptoms as well.
And there are eye drops as well that are utilized during allergy season.
There are antihistamine eye drops that are utilized that can be helpful. Once again, some are over the counter and they can be very effective. There are prescription ones that are available if the over the counter ones are not working.
Okay.
There's another allergy medication that we sometimes use called montelukast, that is helpful for some people in treating both allergies and asthma. But people that have allergic asthma that is triggered by some of the allergens in our environment, sometimes we do need to use some inhalers on a daily basis, inhaled steroid medications to decrease inflammation, to help treat that bronchial aspect.
When it comes to antihistamines, specifically the long-acting, let's not talk about the diphenhydramine, because I think we need to warn our audience again. Diphenhydramine is a great antihistamine.
Yes.
It is very short-acting.
Yes.
But it seems to be the most causative of a drowsiness factor.
Absolutely.
So when driving and such, please take precaution if
Yes.
you're going to take that. When do you recommend taking the long-acting? Morning, night? Doesn't matter in your opinion?
It doesn't matter in my opinion. Sometimes some of the long-acting ones can cause a little bit of sedation, and if that's the case, I recommend taking it at night so that it's kind of worn off at least a little bit by the morning. But I don't find that that's a complaint often, so I don't really find that it matters. But one of the things that I do often recommend to my patients that have seasonal allergies is that it's important to start the medications early, not waiting until the season's upon us and symptoms are already there and we're kind of trying to backtrack and get rid of the inflammation that's already there. So at least 2 weeks before the onset of the season, I think is a good time to start either the antihistamines or the nasal steroid sprays or whatever your allergist or physician recommends to you.
So this would be around
this would be a perfect time to get started.
This time as the season is approaching
Exactly.
very quickly.
Exactly.
I think you might have hit on this, but what are some of the steps our audience can take to manage their allergies? We discussed medications. Are there other things that we could do at home, to make sure that our symptoms are either diminished or maybe taken care of before the season starts? And we could just re-hone on that because I think it's important.
Sure. I mean, at home, I think it's important to be aware of your allergies. I think it's important to sort of remember what happened the year before so that you're not starting everything too late.
Okay.
I think it's important to follow some of those environmental precautions and keep windows closed, and for people that are pet lovers and have pets at home, when your dog goes out and comes inside, wipe him down so that he's not bringing pollen into the house and spreading it everywhere. On those really high pollen days, even rinsing off when you're coming in midday so that you're not sitting on the couch with pollen all over you, so that it's going to affect you later on. And just following up with your doctor if you have questions, if you think that your previous season was not well controlled, either with your primary physician or with your allergist, so that you can get a plan in place. I think having a plan is an important thing so that you can go into the season feeling prepared and have it be as comfortable as possible.
Anything in the pipeline, doctor, that's coming up for allergy treatments, or something that you do in your office that we haven't discussed yet?
Well, so one of the other things that we recommend for a lot of people with allergies, both seasonal allergies and year-long allergies, is something called allergy immunotherapy or allergy shots.
Okay.
It's been around for 100 years. It's a proven treatment. It's a safe treatment, and it's probably one of the most natural treatments. We're actually taking small injections of the things that you're allergic to and desensitizing your body and teaching your body to act in a much more normal way to these allergens, so that over time you're less symptomatic, you're taking less medication, sometimes no medications, and they really are very effective for most people that use them.
So just to describe this a little more to our audience, so these are basically allergies that a person's, the individual is allergic to,
Sure.
that we're introducing to the body at very minute doses.
Yes.
And do you increase them over time, or how
Yep.
does that work?
So patients come into our office initially weekly, and then once we get to our therapeutic dose monthly, it's just a very small increase in tiny allergen doses to teach your body to act in a much more normal way.
What's the typical time of therapy for those individuals?
Typically about 3 to 5 years is the time that's been shown to have the greatest chance of long-term effect once the allergy shots have stopped.
And I know with one of my kids, the doctor recommended that we start him as a young child.
Sure.
I think he was 11 or 12 years of age to get those shots. Does that make a difference in the long run?
It can, yeah. So 5 is about the earliest that I start allergy shots. I do have quite a few younger children, school-age children in my practice. And some of the benefits of starting early is that allergy shots have actually been shown to prevent further sensitizations to other allergens and have been shown to prevent the development of allergic asthma from allergies. So in children that do not have asthma, that do have environmental allergies, they're at risk of progressing to allergic asthma, and it has definitely been shown to decrease that risk.
And those kids are also in a 3 to 5 year cycle?
They are.
And typically, do we see allergies come back in adulthood?
They can. They tend to come back in a much more mild form.
Okay.
Everybody's individual. Sometimes allergies don't come back. Sometimes they come back way into adulthood, and sometimes they can peter on back up shortly after allergy shots have stopped. So it's always a conversation that you have to have with your physician, but they tend to be pretty effective in the long term.
Excellent. Now, so like I said, I just go back to one of my earlier questions.
Sure.
Some people have allergies to pine.
Yep.
Some people have allergies to a zillion things. Again, it's just because of the genes or the environment, or what do you relate that to? Because sometimes even people that have many allergies, their symptoms are not as bad as those that have one allergy or such. So can you just explain that a little bit?
It's hard to say. It's really multifactorial, and some of it is genetics, some of it is what you're exposed to, some of it is different things in our environment that we're getting exposed to just in this day and age. It's a hard question to answer. I don't have a great answer for that. And there are definitely people that are allergic to one thing and people that are allergic to everything. And it's hard to predict.
You mentioned mold earlier.
Sure.
We live in New England. It's very wet environment.
It is.
And such. Can you just hit on that, when it comes to whether mold outside or inside the house, and how do we protect ourselves as individuals and protecting our families from such a allergen?
Yeah, you're right. Mold can be an issue both indoors and outdoors. Mold tends to thrive in human environments. Outdoor mold tends to be more of an issue when it's really wet and damp and moist, in the fall when leaves are falling and decaying, in the spring when all the snow is melting, especially if we've had a lot of snow in a winter and everything's really wet and damp from that. And so the more moisture we have, the more mold spores there are going to be. Indoors, making sure that there are no leaks, making sure if there's any water damage, we're taking care of it right away. Being careful using humidifiers. We don't want environments to be too moist and too humid so that they're causing mold to be more of an issue.
So do you recommend humidifier in the house, or you typically?
It's not something that I typically recommend. I mean, different people have different heating systems, and if it's super dry, then it's something that we can kind of use from time to time. But really humid environments can cause both mold and dust mites, which are two really common environmental indoor allergens to thrive. So it's something that we really have to be careful about.
Okay. Anything natural out there that our audience could utilize for allergies?
I truly believe that the most natural allergy treatment is allergy shots, because we're giving people injections of the things that are in our environment and kind of teaching the body to mount its own response to act naturally against these allergens. A common question that I have from a lot of patients when they come in to see me is about whether taking small doses of raw honey is going to act as an allergy remedy to them. And And my answer is usually not. Everyone's very individual. But when bees make their honey, they are actually incorporating, or intentionally, I should say, incorporating flower pollen into their honey. And flowers can cause allergens, but they're not the largest contributor to seasonal allergies. And so some tree and grass pollens and mold spores are incorporated into raw honey, but it's sort of an inconsequential thing. It's a much lower amount, so tends not to make a huge difference in seasonal allergies.
And has that been studied?
I have read a couple of studies that have looked at raw honey and processed honey and then placebo honey flavored products, and there wasn't any statistical significance between any of those products. So I have seen some studies showing that it isn't particularly useful. And actually people that are really sensitive to pollens have to be careful, because people can have allergic reactions to raw honey or to the pollens that are in that. So you have to be a little careful in doing that as well.
Have you had encountered any patients that needed epinephrine injection or such, because due to allergies out there, in the sense of seasonal allergies, or do you typically see that more in food and?
We tend to see that more in food and some other allergens. I have had one patient that was sensitive enough that she did have really severe, potentially bordering on anaphylactic reactions to tree pollens.
Wow.
But it's not common. Sure. But there's a huge myriad of sensitivities. So
we discussed the antihistamines as a treatment. There's also the decongestants.
Yes.
You know, that's utilized a lot in our population. Can you discuss that a little bit in the treatments of allergies? Do you use a lot of decongestants?
I don't use a lot of decongestants. I use some decongestants in combination with the antihistamines.
Okay.
I try to focus on treating the inflammation, because that's really what's going to help treat the allergies in the long run. Sure. So I think getting a plan in place that is a focus on the long-acting antihistamines, the nasal steroid sprays to decrease inflammation, and other things if necessary, is sort of the baseline, the stepping stone for treating allergies appropriately. Occasionally, when people are really sensitive and their allergies are not well controlled with a great plan, then sometimes using the decongestants here and there can be helpful. But I think we have to be a little careful with the decongestants. And
absolutely. Can you discuss why?
one of the things in particular that I recommend against is using a lot of the nasal decongestants, because they can cause some rebound congestion. They can cause some the nose to actually become addicted to them, so to speak. Sure. So a lot of people come into my office using the nasal decongestants on a regular basis and find that it's really hard to come off of them. So it's a much better plan to speak with your allergist, speak with your physician about what medications are really more effective than the nasal decongestants.
I mean, typically those nasal decongestant sprays are recommended for maybe 3 to 5 days.
Exactly.
And utilizing it for longer could potentially not be helpful at all.
Exactly.
Maybe make your symptoms worse.
Yes.
And the other factor, as a pharmacist and as a doctor, we should discuss with decongestants. You got to be careful. There's a lot of contraindications when it comes to pseudoephedrine as a decongestant, or other decongestants, whether it's high blood pressure or thyroid condition or other other conditions that we have to be careful with. So always talk to your doctor, talk to your pharmacist.
Absolutely.
When encountering such, as we discussed with the antihistamines, with drowsiness, with Sudafed, you got to be worried about contraindications.
Yeah.
So thank you so much for sharing that.
You're welcome.
So I have allergies. It's February.
Sure.
I made an appointment with you.
Yep.
What are you gonna? I come into the office. Can you go over the steps that you utilize to treat me as a patient?
Sure.
Please.
So, I mean, the first thing that we always do is take a really thorough history. I think that's important to know other medical conditions, medications that you're already taking, so that we can kind of treat you as a whole. Get a thorough allergy history, because allergy conditions can kind of go hand in hand. So a history of other environmental allergies, asthma, and food or medication allergies. And then based on the history, then we decide to do some limited testing to find out exactly what triggers are. There are a couple of different ways that we can do allergy testing. We can do some allergy blood work, but I tend to do more of something called skin testing or prick testing. I find that it's a little bit more sensitive. We can kind of tune into the exact things that we're looking for, and it's quick and it gives us immediate answers. So the way that we do allergy testing is just little pieces of plastic. We do some little scratches on the forearm or on the back, and within about 15 minutes we can figure out what sensitivities are. Sometimes we'll do a slightly more sensitive test called an intradermal test, which is a couple of little injections in the upper portion of the arm, which sometimes gives us some information if the prick testing is not conclusive.
And that's also done for food allergies, correct? Same kind of concept.
The scratch testing is done for the food allergies. We do not do intradermal testing for food allergies. And then based on history and testing results, then we come up with a plan for both environmental modifications, different allergy medications that would work best for you, and whether or not allergy shots are something that would be helpful for you. And actually one of the sort of newer forms of immunotherapy that we're using is something called sublingual immunotherapy as well.
Wow, okay.
So what that is at the moment it's FDA approved for both ragweed and grass pollen.
Okay.
And there are little tablets that get placed under the tongue, and we use them during the season, and it's a form of immunotherapy, and it's been shown to be effective for those two pollens.
Great. With spring right around the corner, many are already starting to feel the effects of the allergy season, which is why we are so pleased that Dr. Narayan was able to educate us about the seasonal allergies and to what we can do to minimize the symptoms. Thank you again, Dr. Narayan. I appreciate it. Please follow us on Facebook for more information on healthier you topics. We appreciate your time. Thank you so much.